Hi, this video is the demonstration of the FUE scar a year follow-up, and he actually had two procedures. And again, the scar is there, but it's really hard to see. And you know, a lot of clients worry about the different size of FUE tip used, 0.8, 0.6, 0.7, 0.8, 0.9, 1.0. Well, let me tell you, I don't use 0.6 and 0.7 because those tips, they're not going to produce good results, so there's no use of using it. A lot of doctors advertise that. Yeah, that's up to them, but maybe they have better skill than I do. But ultimately, you want to have the best result, and you pay a lot of money to have excellent density. There's no use of using the smallest tip and you kill all the graft and then you have bad result. Yes, the size different, and I use 0.8, 0.9, and 1.0. Yes, the size are different, and shortly immediately afterward too. But when it comes to have the result, the scar a year later, guess what? It's almost identical. You can't tell the difference with the naked eye. And so I just want the patient and the audience to understand that we do hair trying to have the best result, and the surgeon, we try to minimize the scar, but we always have the ultimate goal is to give you the best density. And to get the best density, we gotta test whichever tip to yield the highest, most healthiest root. And the more the healthy root, the more it grow and the more density you get. Okay. And again, this client has excellent result, and he's we show the audience that the FUE donor scar a year later, and you can't even tell the difference. And he can wear his hair really short, walking around. He just cut his hair, and no one see it. And even he himself say, I don't really see it. Again, sometimes during recovery, it might be scary for some people because you go through shock loss too. So not just recipient shock loss, but the donor shock loss. But those are temporary. The hair shed and they go to sleep, and it takes many months up to a year for the hair to regrow back. Again, the 0.8, 0.9, and 1.0, they are different in size. We have to test the tip. We don't know which tip until we do the surgery. And don't judge the donor scar right afterward. Judge about the result, how dense it is, and judge the donor scar a year later. Okay, not immediately afterward. It makes no sense immediately afterward. You're always worried about a year later walking around. There's no surgery without scar. Okay, and again, you rather have a little bit scar and have best result than have no result and a perfect scar. I mean, it makes no sense. But if you can see my demonstration and you follow all my work, we shave the patient down, walk around, and with the FUE a year later, and you can barely see the scar. Okay, thank you.